Thank you so much, Dr. Vikas, for joining us on a podcast at Dawdle. Extremely grateful that you took out time on a Sunday afternoon, to share your insights with our global audience. Thank you so much again. But before we go to the topics, we've got very interesting topics to discuss with you today. But before we go there, sir, if you could take us to your journey so far, your career so far, in this domain.
Let me introduce myself and good evening to all of you. I am Dr. Vikas Shankar. I am a practicing dermatologist in Patna, is the state capital of Bihar in India, and I am associate professor in Nalanda Medical College and Hospital, Patna. And very active. I am a community dermatologist also, which is doing a lot of community service in this part of globe, as well as I was state secretary for my national association, that is Indian Association of Dermatologists, Venereologists and Lectologists for 4 years. And I was also served as a national joint secretary of my association, that is IIDGL. So I feel proud to be dermatologist and serving humans.
Thank you so much, sir. And the first topic that we have is around the evolving science of skin health.
Yes.
We all know that dermatology today spans more than treating acne or pigmentation. It covers immunity, lifestyle, and also mental health intersections. So how do you see the science of skin health evolving in the last decade, sir?
So let me say this. Dermatology today stand at the crossroad of science, technology, and human emotion. And the skin is not just a largest body organ. It is a storyteller, a mirror of your health, and a reflection of how we live, eat, think, and feel. So, in this, what we are going to have a conversation, I would like to share how dermatology has evolved from a pure clinical specialty into a discipline to that it's connect with wellness, psychology, and innovation, and where the future of skin health is heading, especially in this part of globe, that is India. Now, coming to your topic. Over the last decade, dermatology has experienced far beyond acne pigmentation. The skin is now understood as a active immune organ communicating constantly with our internal system, hormone, the gut microbiome, and the nervous system. Diseases like psoriasis, eczema, vitiligo are not only viewed as an isolated problem, but they are part of complex systemic imbalance influenced by genetic stress and environment. So this shifts toward the systemic based dermatology has changed how we treat the patient. We now focus on long-term balance, strengthening our skin barrier, addressing the inflammation and supporting overall well-being. It is not just about the treating what is visible, but it's the matter about healing what is beneath the skin.
Dermatology as a branch which basically deals with cosmetics, the skin diseases which people face is as harmful as the other diseases which they are facing.
With the surge in the this cosmetology market, and there is a lot of social media influences there and is there in this society in this generation. But let me tell you, dermatology is a basic core dermatology, clinical dermatology, and who doesn't know the clinical dermatology cannot treat this aesthetic treatment as per the matter of excellence. So for doing even the cosmetology and this aesthetic practice, you need to know the basic of your skin and where we stand now. So those who are good at core dermatology, they are the best cosmetologist or esthetician, dermatosurgeon, hair transplant surgeon, because they only know what, when, and how and where to treat.
And with the rise of all these AI based skin imaging, sir, like, digital dermoscopy and computer aided diagnostic, how has technology changed the way you access and treat skin conditions?
AI is, yes, it is the era of AI where globally this AI has proven informative detection or some lesion detection. AI driven dermatoscopic tools are there with having very suspicious lesions where our this judgment is somehow confusing. This AI may help, but it cannot just replace the human touch, human empathy, human that touch science. It cannot be replaced. So if the both is coming together, working together, the AI intelligence as well as the human touch, I think it will be the best solution for future healthcare.
Yes. So can you talk a few things about about the ways in which technology is being used in the domain of dermatology?
Technology has become an integral part of the modern treatment, including dermatology, and
Yes.
the instrument like digital dermoscope or AI based skin this imaging or 3D photography has transformed how we diagnose and monitor the diseases. This AI can analyze thousands of microscopic images within seconds, detecting this pattern invisible to the human eye. But these tools helps us identifying early melanomas, that skin cancer, assessing pigmentation disorder, and document the chronic lesion with precision. Yet technology and is an aid. It is not a replacement to human. The human eye, touch, intuition remain unmatched. True progress lies in the synergy between the data and the judgment, where dermatologists use technology to enhance precision, but never lose the human connection that patient trust.
Got it. And could you also, take us through, sir, since you have been into, into this domain for a very long time. What are the changes that has happened in terms of, diagnosing a skin condition, say 10 years, before and now? And what is the awareness that you are seeing amongst the people in terms of identifying with the skin problems coming to you, in terms of the awareness that the people have?
Yes, sir. When I was doing my post graduation, that era was different. When I was very early in my profession, in that era was different. Now I am senior dermatologist at my place.
Hmm,
This time is changing fast and technology is changing fast. When
hmm,
we was only having the lens in our hand and one what you lens with light. Now we have dermatoscope. Yes, when I was passing this dermoscope was passing my post graduation, this dermatoscope was in our hand, but not very we haven't very used it. But now Dermoscope is in every hand. Now it is era of artificial intelligence. Now this artificial intelligence is again changing too fast. Now
hmm,
we have to be very much accommodative, adaptive,
hmm.
as well as very much subtle with this new technology, where we should know where to use this technology and where to use our own technology, that is in future it is known as human technology. Now there is one artificial technology, AI, and one artificial intelligence, that AI, and there is human intelligence, that is HI. So we need a balance between this, and those who will learn to have a balance between this. I think they will progress more. They will have more say in this domain, and I think now it's time has come to accept the changes and move forward.
Got it. So what are those changes, sir? Like, what are those changes that has happened?
Suppose that previously it was a simple, in layman's term, it was eczema. Now, after seeing 10, 15 years back, was knowing, okay, this is only diagnosed as eczema or some other differential diagnosis. Now, with the AI not going to invasive this biopsy, we can have some more details, micro to micro details in our domain, and with this the diagnosis may change to something else. So this is the change in the technology with the all AI, where this AI can see more personalized, more detailed data can be given. So I want to say that we need to adapt and have acceptance of the new technology with our own intelligence. Then we can have more better diagnosis and patient care. That I want to say.
Got it. Got it. So there has been a lot been talked about, so, things have been moving beyond generic prescriptions. Like every patient skin reacts differently to environment, diet, and stress. So how are you leveraging genetic, hormonal, and microbiome based insights to personalize the dermatological care?
So no two people have the same skin. Each skin and individual genetics, makeup, environment, diet, and the stress level influence how their skin behave. Now this personalized dermatology focus on tailoring this care to these unique variables, and advances in the genetic, hormonal profile, and microbiome analysis are allowing us to design treatment that are specific to each patient biology. And here we are beginning to integrate these insights, choosing a therapy based on skin type, climate, lifestyle, and the goal is to move from one size fits all to one size fit one. So this approach not only improve the outcome but also build a patient trust in evidence based, and it is more customized care.
And now the cost has also increased, sir, a lot. A lot of these skin dermatology, related treatments are very costly. So do you think that, dermatology related treatments are more for the, people who are rich? And
There is two part. One part is dermatology treatment and one part is aesthetic treatment. So dermatology treatment, other than biologics or new molecular, which is just launched in India, they are costly. There's a part of government and that is the this industry part. Otherwise, dermatology treatment is chronic, maybe chronic, but not very costly. It has some say as compared to other this neuro, cardio, and other department. It is comparable less costly. But when you talk about the aesthetic and cosmetic treatment, when you are moving towards the technology based and more advanced chemical based, which are imported from the outside country, that are the costliest treatment because importing from outside country, the laser machines, the chemicals are costly as compared to the core dermatology treatment. So there are a lot of things in the industry. It's all depend ki whether your this instrument is FDA approved or somehow a very good quality. That matters a lot. Where there is a low cost based machine, which where the efficacy may be doubtful, they may have a very that different outcome. Suppose that I am having in my own clinic world best diode laser for this hair reduction, LHR, laser hair reduction. And it costs around 50 lakh rupees. And suppose that another my colleague is having only 5 to 10 lakh rupees of machine. So obviously my machine is the best machine. We will get the best result out of this, but it will be a costly for the treatment for the patient. Suppose that I am using a chemical was imported from somewhat in UK or some other country, which are costly, but some chemicals are here only, which are low cost base. So the but I'm using the evidence based more filtered chemicals that will be less harmful to the patient. So this way, the cost of the treatment varies in cosmetology as well as aesthetic practice. So yes, the cosmetic and aesthetic practice is bit costly as compared to core dermatology treatment and practice. But you need to check your device and machine where you are going, what kind of machine it is your physician and doctor and dermatologists are using, and according if they're charging high, you must ask why you are charging high. Is there the instrument cost from where these instruments are built? So you can have that things can be answered in this way. Yes, I faces sometimes few of my machines are world class and they are the costliest machine in the world. So the cost is definitely higher side as compared to other colleagues. But I assured all the patient that this machine is one of the best machine, and you will get the best result as compared to other practicing dermatologists. Yes, and more important factor is I'm very much satisfied because though I am taking a higher side of charge, but when I see the smile over the face of my patient, this satisfaction, actually it gives me immense pleasure that yes, though I have got the costliest machine, even I'm not getting back the machine actual price, but that smile gives me more satisfaction than money.
And one interesting question that I have is like, what is the percentage of men are you seeing coming as a patients as compared to women?
There is no gender biasness equally. Now everything is people are more aware, they are
Yes.
more sensitized, and everyone want to look good. So your face is your mirror of your heart, and your skin is mirror of your health. So it is likewise. You want to look good. There is more awareness these things. So there is so much boom and surge in the cosmetic and aesthetic market also.
And so, if you talk about conditions like, I'm not able to read the names, but like it's like psoriasis, alopecia, and eczema. I hope I'm pronouncing them well.
Yes, yes.
They usually have psychological triggers. So how do you integrate mental health evaluation into your dermatological practice?
Skin and minds are inseparable. The emotional distress can worsen the skin condition, what you call psoriasis, alopecia, eczema, vitiligo, and these can in turn can trigger the anxiety and social withdrawal. So, if there is not acceptable in the society, they may cause some psychological distress, and there is a social withdrawal. And in psychodermatology, where we treat both the physical symptoms, the skin symptom, as well as that emotional change. Few things we have to give. A few minutes of listening often so much that the healing as a prescription. So you need to give more time to patient with these diseases or this kind of skin conditions, and in collaboration with the psychologist or psychiatrist and counselor, which is a very vital thing. I generally do not treat when I see my patient is in very low mood or in a very different mental condition. This stress and distress is there. Sometimes withdrawal from the society, not going to office, not going to school, or some marriage issues. So I always refer my patient to psychiatrist where the treatment is needed, psychologist or counselor where counseling is needed. This is one of the most vital part of our treatment. And by addressing the self-esteem stress alongside this medication, we achieve more complete and compassionate outcome. So healing the skin often begins with healing the mind.
Healing the skin begins with healing the mind.
Yes.
Less stress is also associated with healing of skin, sir. Like, is it?
Yes.
So what is the contribution of stress to skin diseases, sir? Like, is there a direct correlation?
Yes, there is this in body. There is skin, this mind axis, skin gut axis. So there are different axes, and suppose that when I am in depression or in a low mood, I will not eat well. So I will not drink much. So my skin will may become some dryness will be there and some immunological changes will be there. And with this, you may have dry skin, may have itchy skin, and then you start itching and then new cascade will go on. And so sometimes patient in an anxiety, sometimes in low mood. With every disease, when this psychology or mind part is brain part is coming, there is some more changes in the skin also, and immunological part of the skin also, the physical part of the skin also, and these changes all together trigger a new skin condition that will make the that present skin disease in a more complex way.
Itself. So one of the things that has been usually talked about is about how do you maintain clinical integrity? Because customers will demand a lot of, they will have a lot of aesthetic demand and all that. So what ethical boundaries must the field protect as, the beauty medicines become increasingly commercialized?
When you talk about this ethics and dermatology, we always promote what not to do, why we should do, and what you should not do. In the era of this social media, where everything is influence, I was watching in social media one this suddenly a new pop-up was there, and the person was telling कि this molecule is not good, your doctor is giving this molecule, it will harm your body, and they have read and presented the matter so well, a well linguistic thing, well actor like manner, that I was also was so much surprised and a bit influenced ki, oh, this what the person he or she is telling in a such a joyous and effective impactful and role play like oh, he's telling the truth. This is how we got influenced. Now this aesthetic or cosmetic ethical practice is both on the two-way side, where the dermatologist must stay with their ethics treatment, where to do the treatment, how to do the treatment, and how to aware the society what is needed and what is not needed. And the second side, other side of the table is the patient. Nowadays, patient is in very much of hurry, is influenced by the social media, and they want the immediate result. They are coming to us and they are applying all the unethical things, and they are coming to us with doctors, how long do you will treat this and how immediate you will cure me. And they have applied so much of steroids, so much of unethical molecules, and they have ruined their skin condition, almost a permanent damage. Now it's a two-way ethics. The dermatologist must say what is the truth, and I always emphasize the patient why you have applied this of these treatments and how you acquired this knowledge. I always ask my patient, from where you got this. I start planning my prescription, how to move with this. And every patient is individual patient, different patient, and we need to approach every patient in a different way. Then I used to plan my treatment, talking with the patient. I will say there is a term called patient connect. You need to connect with your patient. Actually, what is happening in their skin, mind, well-being, emotion, everything. And likewise, I need to talk my patient a lot. My patient, they know me well. They talk them a lot. I always give a sufficient time and then rule out what are the possible ways, and then how can I reduce the cost of that treatment, and what best molecule I can use. Using the technology, I'm very fond of the best out of best technologies. So that part is very clear, though may be costly. But yes, those who are under my treatment, my patient knows Dr. Sir is always refusing the aesthetic treatment when it is not needed. And that is the main say in the part of aesthetic practice. You should say no when there is this no need of that person. The patient will come with unrealistic expectation and unrealistic knowledge. Okay, I am going to be cured by this laser, and within 5 days or within one thing. Exactly, when I examine and have a history taking with the patient, I observe ki there is no need of any laser treatment. Simple medicine can cure it. But sometimes patients are not very realistic. They become angry. No, doctor, you are not giving me the treatment. And all this ethics part here only, you need to refuse the treatment. Honestly, you need to consult the patient. Why I am not doing this treatment? Because it is not either not needed, or your skin may become more uh, uh, unhealthy, ill with this treatment, and there are few side effects. Please go with this treatment. There are a lot of things going on the social media they are promoting, but actually it is not needed in this part of globe or your skin, because all these devices are made for some another skin type, and you are living in this part, your skin type is different. Sometimes there are more side effects with these laser machine. So I always used to tell my patient all the negative part of the patient as a filtering the unrealistic patient, because all the aesthetic laser surgeon who are doing practice, they know when you tell the truth this may happen. Sometimes the bad patient will go away from you and you are more happy not getting that bad unrealistic patient. So, in your clinical practice, you need to tell honesty before the treatment. And that is the best part of the ethics. If you are following this ethic, then other ethics, all your ethical practice will be good. And one more important thing, when you are doing your practice, you need to slight under treat your patient, not never treat your patient. Two lines are very much important. Never over treat the patient, always under treat the patient, so that the patient is in safe hand and you are also safe, because you are going to treat the patient in over more way. Sometimes there is permanent skin damage. Again, the patient is, suppose that you are not going to treat it, give a bad treatment so that there is another scope for better treatment will be lost treatment. That is maze, and again one other part of the ethics. Then don't be hurry. Being a specialist, we have been taught, don't be hurry of the treatment. You need to do evidence based treatment, evaluate the thing, take the history, investigate the thing, and then make a proper diagnosis, and then you treat the case, because your job is not a general physician job, not a house physician's job. You are a specialist, so you should act like a specialist and you should treat like a specialist.
So, what are the various technologies and kind of imaging techniques that are used to detect cancer, skin cancers?
When you talk about this skin cancer, you have this dermoscopy, AI based scanning system, but not very common in India, this AI based scanning system. But you have this dermoscopy in India, and with dermoscopy, there are certain criterias, there are certain evidence-based things. You need to follow that. And I think for early detection and screening, that dermoscopy is very much important. So you can have this. This is the most latest technology. You can have the non-video and video dermoscopy. It will very helpful.
So, what is this video and non-video dermat?
One is handheld. That is only you can see, and you take the external photograph with your dermoscope. And one is video, where this all the images are in the video like recording is there. You can see the screen. You can move. Is there is a big screen like thing, and you can see in the laptop or system. You can see. So one is the photographic or this handheld, And one is videoscopy. You can touch the skin and everything is visible in the screen and it will record it as a video. You can take a snap also. So these are the things.
So we'll also talk about a bit about the skin problems. So have you seen the difference in the kind of skin problems that are faced by people who are living in metro cities and by the people who are living in, say, a tier two or a tier three, three kind of a city?
The last part of your question is
So what are the differences in terms of skin problems that you see with people living in a tier one city, say a metro city, or the people who are living in rural setups or a tier three kind of a city?
what I believe there is no difference because now every even village is having all the product, getting product by online marketing. Tier 1, tier 2 city, everything is available in every part of India and part of my state, that is Bihar. So I don't think this online treatment availability and online purchasing availability and capacity has tremendously increased in this part of globe. I don't think there is any much difference, but patient coming from the rural part of Bihar to me or even the from the my state capital where I am practicing, it's the same. Only thing is in the nearby districts or in the same place where I am practicing in Patna, people are approaching early. In the remote place, they need to more time to reach to a genuine dermatology. So there will be more chance of more this skin changes and damage if you are approaching late. Otherwise, we are facing a menace and very much this quackery also in this part of globe where the non-specialists or non-dermatologists are practicing dermatology and they are actually bad for the patient. Even the OTC products are easily available in the name of cosmetic and other steroid-based mist creams are available. People and patients are applying it and coming to us for the treatment sometimes too late and they want the guarantee from us case we when you will cure us. Sometimes there is percent skin damage, that is permanent skin damage like stria and all this and pigmentation. So a new term has evolved, not new, it's not, it's old, that's topical steroid dystrophy face or like this. So there are a lot of things. I don't think any difference between the tier 1 city and tier 2 city. Everyone is same. Even the educated persons are not using the proper medicine, not visiting the this specialist, the dermatologist. They are somehow going to the medical shop taking their OTC product. They are more happy. And when the steroid based creams are applied, there is a feel good effect with the steroid. The lesions of the skin are suddenly gone, vanished like anything. And after some times, it is coming again back. Whether it is educated or uneducated person, again he or she is applying, and same will go on after some times. Now this steroid will stop this responding to the skin. There is more of erythema, that is redness. There is striae, that means there is bristling of the skin, or there is a crack on the skin, like just like it's a skin of the any pregnant lady. So I think when there is permanent damage, the patient are now coming to us and said, "Oh, this is happening. I'm not getting cured. It is happening for the last 2 years, 1 years. I'm using all this medicine." Actually, even they are not aware of what is going on, what is happening. This steroid cream, when they are systemically absorbed, can change your bone, eyesight, gut, and sometimes there is skin permanent damage. So my say to the community, don't treat yourself, don't get your body treated by any medical shop owner. They are not doctors, they are just a medical medicine sellers. And to the government also, few products must be banned in India, and few products must not be the OTC product like steroid and all these things. Without prescription, you cannot give. Without the specialist prescription, you cannot give this molecule. Our association, that is Indian Association of Dermatologists, Venereologists, and Leptologists, has many a times asked the government of India to look into the matter. We have an PIL in the Delhi High Court for the patient safety concern because ultimately we are answerable and we are blamed that we are having a costliest treatment. But we are not to be blamed for this. Patient and the society must be blamed for this by themselves only because they are treating. Sometimes we got to learn that that person is non-alcoholic, non-smoker, even teetotaler, and with no addictive habits and no bad habits, and is having some kinds of cancer. Now, these unknown medicine which people are taking by self or by the OTC products or by the medical shop, and how it is going to work in the body, what the effect they are going to get with this medicine may be all right as of now or as of today, but that chemical, that things remain in the body in long terms, it produce some bad effect. And now the everyone in the family is not disturbed. How is happened? He's such a good guy, not having addictives. He has done nothing bad in life. What one single mistake in life by taking medicine by self ruin your family, you, your career, your all friends, that you have to suffer so many things. So be aware. This is a new era. New chemicals are coming, and these medical shops owner are not knowing the exact molecule, how it will work, why it will work, and what are the side effects. When the patient are coming to us, they are asking too much of side effects. Sahib, and I'm telling you in Hindi, Doctor Sahib, इसका कोई side effect तो नहीं होगा ना? So doctor, there is no side effect in this medicine, na? Because I am taking lot of medicine prior to coming to you. I always ask my patient, have you asked the medicines of all the medicine you are taking? You're coming to a specialist and you're asking me, I will give you all the answers. But you should have asked first from these. And it is not the mistake of the medical shop owner. It is the mistake of the patient, with the community that they are going to them. So this is an awareness message to all my listeners, viewers. Please don't treat yourself, get treated by the specialist, and it's the era of super specialization. So get in touch with the best doctor in your city and get treated.
So also, what we have seen post COVID is that a lot of virtual consultations have increased, especially related to skin consultations have also increased. So, so what are the clinical limitations of all these virtual skin consultations, and how can digital tools be used to enhance the accuracy?
When you talk about this virtual or digital, this in especially in the COVID era where we was not actually, we were, but we was busy in treating the COVID patient, and there was restriction in our availability openly. You people was not going outside the home, and you have some problem. So at that time it was okay. But I, in my clinical practice, don't do this online treatment, because what we see in online sometimes is very less. What the patient is showing is not very relevant with the diagnosis. I don't encourage this online treatment, because many a times you need to touch the patient's skin to make the diagnosis. You need to see the patient, you need to examine whole body, and this quality of image when you are going to see with your eye and when you are going to see with your lens eye is different. Sometimes the actual lesion patient is not going to show because he or she is not aware what to show, and they may be showing some different lesion, and according to that the diagnosis is made. I've experienced many a times that this lesion is okay, simple bacterial infection or some one or two boil. It may be a chicken pox or varicella like lesion. So the diagnosis will change when you see the lesion. Sometimes patient or my friends and family members are calling, they are telling me to see the who the video conferencing. So I don't allow them to, because I know the demerits of the thing. So online treatment, I can give some emergency medicine. Okay, you take this medicine and then you come to me. I will see you, examine you. I will take the virtual history. But definitely, this medicine, this distance, this telemedicine, you can call this, or remote. This medicine is good for where this health facility is not, remote village area where this doctor is not available. So from nowhere to somewhere you can give something, at least some symptomatic treatment for the betterment or relief of the patient. So I think if you think for this remote distal area where there is no specialist, no doctor is there, so teledermatology provides a value treatment, and it will bridge between the patient and the specialist, and bringing the specialist to the people who live far behind the hospital. And digital consultation and image based assessment and this AI trigger will make more be accurate in future for the diagnosis. but definitely it will save your time and money also. But as I said, there are always limitation. Sometimes the lighting is not good. Sometimes this camera quality is not good, or lack of. I already told this physical touch maybe compromise, and it will compromise with the accuracy of the treatment. But definitely, when these all things are more good, there is more technology advancement in future. There may be a hybrid dermatology, that is AI, tele, and your own human expertise all together coming in one line, followed by the in-person precisive care. Technology should make the access as easier. It should not replace the expertise.
We talk से sir कौन सी ऐसी regenerative technologies है which are really having clinical potential and what are like kind of hypes around?
So you're talking about this regenerative dermatology, and this regenerative medicine is redefining this skin rejuvenation and repair. What you are talking about, this stem cell or exosome or peptide or platelet rich matrix represent, and it represents a shift towards the worsening of the body natural and healing power. But many unregulated treatment claims a miraculous result without safety data. But your question was which actual this regenerative dermatology is working. So
And what is it?
yes. So in our cases, in our set of this institute based where I am posted as a medical teacher, as an associate professor, and in my clinical practice. So one is institute and one is clinic. This platelet rich plasma therapy, what you call that PRP therapy, it is good for hair and a bit of anti-aging therapy. It is good, but not always in all the patients. So there are certain criteria where you need to look upon the age criteria, the platelet count criteria. There are certain things you need to have before going to start the treatment, as well as the duration of the treatment, patient age. After getting all these things, then the selection is done. Then you can go for this. Likewise, there are other treatment like platelet is fibrin matrix treatment for this scarring or wound healing. So you can go for certain leg ulcer, diabetic foot ulcer, tropical ulcer due to this leprosy. You can have this. It is a good one. Other than exosome treatment shows good for this hair growth and skin, this aesthetic treatment also. But exosome treatment is very new thing for us. We are still learning from the evidence, learning from the patient. Better, I will not comment on this, but definitely it is a new frontier, exosome treatment, and I think it will, if it worked. Still, a very few experience on this part of treatment, so I'll not comment on this.
Sir, I've seen a lot on means on the social media that people are posting ads of getting their weight reduced by 5 kg, 6 kg with the help of a machine that is being put on your stomach and all. Is it really a hype or it really works?
What you see in social media is not always correct. You got my point.
Yes.
So, who is telling on the social media whether he is or she is doctor or an influencer? So that is the thing. Sometimes this ad you can so-called ad, or the this digital imaging, or what do you call that reels, are sometimes good, authentic, sometimes misleading, sometimes very harmful. So you need to get and judge who is telling, whether he is an expert, doctor, specialist, who, or an influencer. Suppose that I will say my this coat is world best coat and it will protect you from all kinds of cold and heat. I will hire a influencer, I will pay them, and they will create a dialogue, and they will tell you in such a language, such an impressive way, such a linguistic. So you need to judge who is telling, what is the authentication of that particular things. So this say my say on the social media. I'm not against social media, but we are actually facing the side effect of social media when patients are coming with your permanent skin damage or bad skin condition, and they want to guarantee you make this thing cure 100% and in a immediate basis. That is the thing. Another thing is ki this liposuction, what you are talking about, and sometimes it's work, not in all patient. Sometimes there are machine will get you the weight reduction, but it all depend upon your personal health condition, your body condition, your hormonal assay, your genetic factor, and associated comorbidities condition. So you need to check all these things. Then you go to an aesthetician, a dermatologist for this purpose. And you can ask them in India. I'm talking about in India. You can ask your physician, doctor, dermatologist, what is your qualification? Are you a dermatologist or a plastic surgeon? Are your degree recognized from the National Medical Commission of India, NMC? Either your degree is recognized by a recognized university of your state and state medical council. And if you're dermatologist, are you a member of IADVL? That is Indian Association of Dermatologists, Venereologists, and Leprologists. I can see few of non-dermat, non this medical from the non-medical professional background. They open their parlors. They are writing their names in the name of doctors, and they're practicing in Patna. I have seen patient falling when in a very bad condition, and feel sorry ki this patient must have enjoyed the life in a much better way than what he or she is now facing. Sometimes there's marriage issue, patient are already expenses expenses in a very huge way to that particular non-dermat, non-medical profession person. And now they are facing a lot of things in their personal life. And again, it will be leading to their mental health. So this all together mixed up, and we feel sorry always for this condition. So whenever you are going to see the skin condition or any option for the skin, good skin condition on the social media, please verify whether it is a good technology or not. You go and meet your expert, your specialist, the skin specialist, an MC recognized, an IADVL member. You check it on the way net on the that particular website of that organization, NMC and IADVL website, whether doctor is actually member of that or registered with that association or commission or not, and then you go for the treatment.
Got it, sir. And at the end of the podcast, would you like to give a few advices to the people to take care of their skin better?
Yes, looking ahead in India, dermatology will blend technology with empathy, AI assisted digital imaging, wearable sensors, and personalized. Even genetic care will become routine, and clinic will be more smarter, and diagnosis faster, and treatment will be more individualized. And the journey of skin health is a journey of connection between the science, soul, and technology, touch, innovation, and integrity. The more we understand the skin, the more we realize that it tells us everything about being human. So the future of dermatology is bright, ethical, and deep human, and it's already here. But for the listeners, for the viewers, take care of your skin and atmosphere. Don't ignore your skin. The skin is your largest organ of the body. Face is mirror of heart, and the skin is mirror of your health. So, if something is not good on the skin, whether it is a spot, whether it is the scaling, whether it is the dryness, or something other more than this, please be alert. Something is not good in your own health, body health. You need to see your dermatologist, a qualified dermatologist. Don't ignore it, because in two condition, in skin and in a dental case, until unless there is no pain, people are ignorant. So please don't ignore. Maybe a sign of some of your internal disease. You can be early diagnosed and early treated. So preserve your skin, preserve yourself. And before ending this podcast, there is a one slok in Sanskrit. Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu Ma Kashpti Bhag Bhavet. That means
Hello.
sabhi sukhi
Yes.
nahi banna pade. That means all be happy, may all be free from illness, may all see what is auspicious, and there may not be any sufferer. Thank you.
Thank you.